let's go way back. Probably about 21 years now. 21 years ago, I was a young girl, just finished high school. So I hate to date myself there, but I had an opportunity to learn how to be a dental assistant from a friend who was an older friend because he was retiring from dentistry. He was an old friend that was a dentist. He was retiring and he wanted to teach. He wanted to teach people more about what he did. So he said, hey, Nina, do you want to learn how to be a dental assistant? And I said, well, that's interesting. Sure. Why not? So I started in the dental practice, going all the way back to how to block carve temporaries with acrylic. And I worked my way up. I did go to Harcum College and I did an advanced program there for expanded functions dental assisting. So in Pennsylvania, I live very close to Pennsylvania, and you can do like restorative and prophies and things like that. So I was like, hey, this is really cool. I love what I'm doing. Let me go learn more. So I got my certification, passed my boards and got my license. And I did clinical dentistry for like 10 years doing that. We did a lot of cool cases that I still remember. Big sedation cases where we're doing full mouth resto. It was great. I enjoyed it, but I am the type of person that I like to challenge myself. So I really wanted to do like administrative, and I wanted to learn. We pause.
So Nina, you said that you were an assistant and you had expanded functions in the state of Pennsylvania. Can you actually explain what you could do and what that meant?
Sure. So in the state of Pennsylvania, I could do composite restorations, amalgam restorations, and I could do polishing. So I couldn't do any scaling, but we could definitely polish. So that was a extended skill that I learned at Harcum College. We had a clinic area that we would practice on the dummies. We would place our matrices. We would then do the composite fillings and amalgam fillings. And then we had to have some real world experience and then pass board tests for the state of Pennsylvania. So it's pretty rigorous. Harcum did have an advanced program, which I was very lucky to be accepted. You have to do some initial testing to be accepted to that program. So I really honed in and focused on that for a while. And I really enjoyed doing the restorations. So, for those listeners that don't work in Pennsylvania or have that type of experience, basically the doctor comes in, you guys would do your preps, you would leave them nice and clean for me. I would go in and I would place all of the restorations, articulate and bring it back in, double check, and patient was good to go. So, we did temporaries and, we could pack cord for impressions. There was a lot of different things that expanded functions assistant could do.